Hand, foot, mouth disease is a highly contagious illness that's caused by a virus, usually seen in kids less than 5 years old. You do see that in adults as well, but more so in kids than in adults. It is primarily a childhood illness, seen commonly in kids less than 5 years old, but adults can get it too. When adults get it, it is much more milder than how the kids present with. When a kid develops hand, foot, mouth disease, they usually present with low-grade fever, just not feeling well, decreased appetite, not drinking very well, and so the parents bring them to our office, we check them out. A lot of times, it's non-specific symptoms, but 2 or 3 days later is when they start developing these red spots, which are usually in the oral cavity, can be in the palm of their hands and some spots in the soles of the feet. So as the name explains, it's in the mouth, in the hand, on the feet as well. Hand, foot, mouth disease is a viral illness. Antibiotics do not work for it, so it comes down to just symptomatic treatment. So if the kid has fever, then over-the-counter acetaminophen or ibuprofen will help bring down the fever. If they're not able to eat or drink, these kids are more prone to get dehydrated. So parents and caregivers need to make sure that they are keeping themselves well hydrated. Offering anything cold like popsicles or ice cream will help numb the pain that they have. And also something soft like yogurt or applesauce can help them with the swallowing. We usually see more cases of hand, foot, mouth disease during summer, but it can happen in spring and fall as well. Hand, foot, mouth disease is highly contagious. So when someone who has the disease sneezes or coughs, the people around them who inhale the droplets can pick up the viruses. It's also shed through the blister fluids and also in their stool. So people who take care of kids who have hand, foot, mouth disease, especially with like diaper change, need to make sure that they wash their hands with soap and water thoroughly to prevent the spread. Surfaces that come in contact with either these droplets or the blister fluid can have these viruses, and that's another way of getting it. So in like daycare centers or even at home, to wipe down the tables and toys and doorknobs, which can actually have the virus and spread.